and so many other doctors that we know have been on the front lines. Nurses, nurse practitioners have been on the front lines. Now I want to talk about the frontliners themselves. I want to talk about the providers, which is you and your colleagues. What are some of the challenges that you see, with you? You can talk about yourself and your experience with your colleagues. What are the challenges that the frontliners are facing with this pandemic as far as their mental health goes?
Of course, number one would be the fear of getting sick. And I'm not talking of catching a cold. I'm talking of sick enough to be intubated, to be in the ICU, because you see them. We see the patients. We see them come in mildly sick and get severely sick and end up being intubated. So that's the number one fear. And of course, the reality of that is I know physicians personally who are dead from COVID-19. So wow. It's real, and that fear is there. Mm-hmm. So number two is that you find that a lot of the other providers who are sick, you are afraid for them. You hear one person is in the hospital and you're worried because you know what has happened to the patients. Yeah. And then, of course, there is the fatigue of being overburdened. Mm-hmm. There's so much. You come to work and you work until you're physically tired, until you're mentally tired, and you go home and you're not rested enough, and then you have to come back to it. So both the mental and physical fatigue really has been a burden for.
Yeah, I can imagine. That's, of course, being my experience from you, there's also that part, of course, the fear is there of contracting the virus. There's also the fear of taking it home to your family members. So I remember at the top of the COVID, at the top of the pandemic, a lot of the providers, some of them would stay in the garage, undress, go straight into the shower. You also had your own special room where you go from the room to the shower. So there was also that fear, especially when you have family members with pre-existing conditions. Yeah. I remember all of that. Like that's, and there's that, is it the Hippocratic oath that you guys have taken of do no harm? So it's hard not to go to work. It's hard not to go out there and continue to face the pandemic and see, just seeing people die and then fearing for your life and then the life of your own family members. Thank you so much for those answers. But then how, and I know we've talked about that, but I just wanted to know what has been the response? What has been the response to frontliners? Just generally across the board, what has been the response from the general public to the frontliners?
The response has been great, especially in the beginning. You wake up. I remember I go to work very early, 7 a.m. I'm at work, and of course that gives you little time to think of packing lunch or anything. But during that time, somebody would provide lunch. Somebody will provide dinner. And when I say somebody, I mean some restaurant will just supply everybody in the ICU lunch.
Wow.
Some entertainer or sports person pay a restaurant to give us lunch. Okay. And I'm not saying this happens once a month. No, this was happening like 5 times a week. Mm-hmm. So that was really encouraging. That as you are giving of yourself, other people who cannot be in the front line are also making sure that they provide something. And we had a few, but some very gutsy people who want to be volunteers in the hospital at a time that the hospital is locking down to prevent anybody from coming into the hospital. So it was nice.
That's amazing. Just the love of people, the response of the public, and just, restaurants bringing food. I think that is very encouraging for the, the frontliners. And then I also want to ask you, how can so besides, showing love, how do you think that the public, family, friends, how do you think we can actually help the frontliners? How do you think we can help you guys? Because of, you've talked about fatigue, you've talked about just the mental anguish and the fear. How can we help you guys for your mental health to improve, to be better?
Get vaccinated. I mean, that's like number one. Get vaccinated.
Okay.
The more people that get vaccinated, the less number of people that are in ICU, and the less the stress on the providers. The fatigue, the number of hours that we're putting in will certainly be less. And guess what? The less the number of strains that we develop. So we're not worried about several strains coming after Omicron. The mutations are less. So really, number one thing that everyone can do is get vaccinated. And yes, the vaccines are here to stay, just like the viruses. So we really do need to get at it and fight it. It is the number one weapon that we have, and we should use it.